Aspirin toxicity is going to flip your acid-base balance. So first with hyperventilation, and then with anion gap acidosis. So sodium bicarbonate exploits this by shifting salicylic acid into its ionized form, and it traps it in its blood, and it forces it out in the urine. So let's explain this with a practice question. 5-year-old girl, vomiting, tachypnea, confusion after she ingested a bunch of probably aspirin. Look at these signs. Sodium bicarbonate is given and her condition stabilizes. What's the mechanism? Well, it's going to be trapping the drug in the ionized form in the blood and the urine. So we're going to shift that salicylic acid into the ionized form. Why does it not promote the hepatic conjugation? So that's the metabolism pathway. It's not going to be enhanced by bicarb. How about intestinal absorption? So that would be activated charcoal, not bicarb. How about increases the drug binding to albumin? So salicylates are already going to be binding to the albumin, but that does not enhance their elimination. You have to get them into that inactive form, and then you can pee them out. Blocks CNS receptor binding. So salicylate does not act via the specific CNS receptors like your opioids or your benzos. Here are the key features. Sodium bicarbonate traps salicylate into its ionized form. That prevents the penetration. So salicylate toxicity. Early, you have respiratory alkalosis. Late, high anion gap, metabolic acidosis. Symptoms, tinnitus, vomiting. So the treatment, sodium bicarbonate. This will alkalize the blood, so traps into the ionized form, alkalize the urine. And that's that. If this is helpful, like and subscribe.